Hey everybody, anybody taking levothyroxine? And if you are, I am going to tell you a lot of things you need to know today about it. And you are on Tom Jones Pharmacist Live Show. All right, you are on Tom Jones Pharmacist Live. If you have a friend, a relative, call them and let them come into our circle. We're going to talk today about drug interactions. We're going to talk about nutrient interactions and how they play along with the levothyroxine. So, if you want to hear about it, I'm going to give you all the information that you ever need to know now. All right, let's start this ball rolling. Start the ball rolling. Yeah, here we go. Now, if you have thyroid issues, you're going to have the possibility of having some drug reactions and drugs actually mixing not well with the thyroid product. It could be the levothyroxine, it could be the methimazole, it could be all of the different thyroid products. It could be Armour Thyroid. But no matter what's happening, foods that have excess iodine can either cause hypothyroidism or hyperthyroidism in susceptible people. So, if you've got thyroid disease and you've not had your thyroid removed, then generally you want to actually be careful with iodine. And also, how about all the over-the-counter cough and cold remedies? They can certainly have a little bit of iodine in them, or they can have stimulants, and the stimulants can be it could be the neosynephrine, which is a nasal decongestant. It could affect the blood pressure and the heart rate. So you can also have health food supplements that contain kelp, and seaweed extracts that contain substantial amounts of iodine. And if you are consuming these, it could exacerbate and precipitate thyroid disease in susceptible people. And how about those cough, cold, vitamins, nutrient that you can actually buy over the counter, the iron products, the calcium products, the estrogen products, and it could be a phytoestrogen, the proton pump inhibitors. And all of these can cause alterations in that thyroid hormone absorption. It can bind to the plasma proteins of the areas here, and sometimes require dose adjustments in the levothyroxine drug itself. So it could actually interact with the levothyroxine. So you really need to know about all the drug nutrient interactions. You need to know all about the possibilities of adjusting the dose and making sure that you don't have that interaction that will occur for that particular product. Iodine deficiency is really no longer a problem in most of the world population. So individuals with moderate or large amounts of iodine in the supplements can aggravate a pre-existing condition. So, all right, now, how about medications that can actually cause hypothyroidism? Actual medications that can cause it to occur in the body. Lithium. Lithium is a drug that we use and has been commonly used a lot. Amiodarone is used a lot. That's the one for the heartbeat. The lithium is more for is the psychotic type drug. You've got sulfa drugs, sulfonamides, prescription drugs. All these are prescription drugs. Anticoagulants, anticonvulsants, the iodine, the interferon, the corticosteroids like prednisolone. You've got the cholesterol lowering drugs that actually, the cholestyramine for testing for the gallbladder. So you have a lot of different drugs that will interacting. It can cause hypothyroidism in the body. Now, the proton pump inhibitors, they're over the counter now. So these can cause actual hypothyroidism in the body. Now, medications that can cause hyperthyroidism, we're going to hit the amiodarone again. That agent that's used for the heartbeat. Amiodarone can actually cause problems in the body, and medications that are used for treating epilepsy, and that would be the Dilantin, the phenytoin. So drugs that and the way that the Dilantin works, it will displace the thyroid hormone in the binding of the molecule, and it will produce an abnormal thyroid blood test. So the actual testing of the function is where the interaction occurs. The thyroid function in Dilantin treated individuals is actually normal, but the mechanism of the drug in the testing is where the problem is. In children who are under seizure control, the Tegretol can also be an increased risk of actually causing hypothyroidism. And valproic acid is another prescription drug that can cause hypothyroidism. So the long-term treatment of children with epilepsy can be the actual valproic acid and the Tegretol can actually cause subclinical hypothyroidism. All right, now let's talk about what we have in our lecture today is levothyroxine specifically. If you take levothyroxine, I want you to know all this because it's super important. I'm going to grab a sip of water here. I've been exercising this morning, so I'm doing what I want you to do. Keep your body in shape. All right. The most common medicine that is prescribed today for thyroid disorder, hypothyroidism, is T4. And we know that to be levothyroxine. Now, we're going to talk about the drug itself. Levothyroxine is T4, and it's actually been the most prescribed drug in America for most of the last 5 years. And levothyroxine is a synthetic form of T4. And when you actually have this, when you take it, it puts the thyroid back to as close to normal as possible. The side effects are depending on the dosage of the drug. and if you are getting the right dose that needs to be given to people with thyroid disease, and if it's being diagnosed and properly dosed, you should really start feeling better. Now, the side effects are few, and the body really cannot distinguish the levothyroxine that you're taking into your body versus what's produced already by the body. However, there are dyes that people can be allergic to. There's the consistency of the tablet is something that people can be allergic to. The fillers, and it's not rare. It's really not rare. You could be allergic to the dye that's making the color of the actual tablet. So if you are, you've got to take that in consideration. And it's going to be a trial and error type situation. Also, I want you to remember the pharmacology of levothyroxine. It has a very, very long half-life. It's about a week, 5 to 7 days. And why is that important? Because it slowly goes through our system. You only take it once a day, but it's a week before you really feel the effects of that daily dosage. So it takes a while for the levothyroxine that you take this morning to actually be working in the body. So if a person forgets to take the levothyroxine today, it's all right if you miss it and you take your dosage at a different time. But it's not all right if you take the dosage along with other medications that can interfere with it, or if you take it with the wrong beverage. So we're going to talk about that very, very soon. So remember, if you forget to take your levothyroxine, and normally I recommend first thing in the morning with nothing but water for 30 minutes to an hour afterwards, don't take anything. So levothyroxine also is in a very low dosage. The dosage is low, 25 to 50 is micrograms, and you really are going to be testing that with a TSH test. Generally, is what most people actually have the test done. That'll be about 4 weeks to 8 weeks to 12 weeks, depending on what your practitioner feels like you need to come back in for. So, also, I want you to remember one other thing. Levothyroxine needs to be converted in the body to T3. T3 is your active form of thyroid. So T4 is what most people are given as far as the dosage, but T3 is actually the converted form of the T4. So there's a lot of different factors, and that's why it's so important that we get this right. Now, that you take it right, and you take it so that there's no interactions with other ingredients that you're taking in the body, whether it be a drug, or whether it be a nutrient, or food, or whatever. So, the more active, short-acting form of the thyroid hormone is the T3. And it has to be broken down in the body by an enzyme. So it's all about how the body is able to convert that T4 into the T3. You need it to be working properly. It needs to be converted physiologically in the best manner, form, or what is needed for the body. So here's how you do it. You taking the levothyroxine and you're going to let it do its job in the body by converting from the inactive form of T4 to the active form of T3. So, and it's all about how the body's mechanisms of action convert and send the necessary signals to the thyroid as far as the TSH. That determines how it's doing in the body. So if you've got the wrong type of food, the wrong type of drugs that you're taking with the levothyroxine that interact, or the wrong nutrients that interact, you're not going to have optimal effectiveness of the levothyroxine. So, all right, if the TSH is what most doctors are studying and determining, so you need to take it, even though I said you can take it, if you forget it totally, then take it at a different time that particular day. But if it's almost time for the next dose, don't take your extra dosage. So I know that sounds funny, but if it's early on and you remember that you haven't taken it, go ahead and take your dosage as prescribed. But if it's almost the time that you would normally take it for the next day, don't take that extra dose. But let your doctor know and document it. Okay. Can levothyroxine be given as an evening dose? And I'm seeing most of the time you really want to take it first thing in the morning. And the morning dose is the standard way of actually taking it. It wouldn't be horribly wrong to do it in an evening dose, but it is not the proper way that your doctors, that your lab technicians who are taking the testing for the TSH recommend it, nor you want to do things the normal way of the way it's going to work best. Now, let's talk about levothyroxine now as far as drug interactions. If you're taking an oral anticoagulant, you need to have your amount checked in the body. A number of hormones, steroids, anticonvulsants, and psychotropic medications will affect that thyroxine binding in the body with the circulating proteins. Iron often is found in multiple vitamins, and that can interfere with the absorption of the thyroxine, and absolutely should not be taken at the same time as your thyroid tablets. So, if you need to take iron because you are anemic, if you've been diagnosed, and if you have a mild hypothyroidism, you really want to take the iron at a different time of the day. There could be a significant rise in the iron and hemoglobin levels in the body. So, it's a no-no to take iron at the same time that you take the thyroid. All right, let's now go to calcium. Calcium can also interfere with the absorption of the thyroid hormone. And if you are on a calcium supplement, and a lot of you are, because of the prevention of the osteopenia, the osteoporosis, and you just need extra iron. You need to not take the calcium. You need not to take the calcium and the thyroid at the same time. You're going to have a modest decrease in levels of thyroid hormones, and you're going to have a rise in the level of the TSH. So that's going to throw off the testing. So that's a big situation in which you do not want to take it. You need to vary that intake of the calcium, and you want to take it at least 4 to 6 hours at a different time than the thyroid. Again, set your time that you're going to take your thyroid. Take it first thing in the morning with a glass of water, and then take your calcium supplement at least 4 to 6 hours later, and that way you can run into no problems as far as the rise of the TSH and the lowering of the amount of thyroid hormone in the body. So if you have, and that goes for Tums or any other form of calcium, it doesn't necessarily have to be calcium for prevention of osteoporosis. It could be Tums for the tummy. So that's another major issue as far as the thyroid. The next one is grapefruit juice. And grapefruit juice has a major problem with lots of different items, different prescriptions. Grapefruit juice is in that P450 realm of the way it processes in the body. So the ingestion of grapefruit juice produces changes in the thyroid hormone as far as how it is released. So we want to take the grapefruit juice and the calcium and the thyroid at a different time. Now, even though it's just wise to do that. Coffee ingestion also reduces the absorption of the levothyroxine. So you need to also, that's why we say water. Take the levothyroxine with water only. So you want to actually have your body work in unison with the calcium and with the coffee and with the thyroid. Okay, let's keep going. Thyroid status is how our bodies handle and metabolize anticoagulants such as warfarin. So you really want to have these. The thyroid state may be associated with a reduced need for warfarin, which is Coumadin. So you want the doctor to take the PT testing so they can determine exactly what you're going to need as far as that dose of the Coumadin and warfarin. Again, there is an interaction there. In fact, there are 486 different interactions with thyroid products and drugs and nutrients. That's humongous. That is humongous. So the more you know, the better off you'll be. Women taking estrogen may need to have their levels of thyroid hormone tested and a dose of the thyroid hormone adjusted after you've taken the estrogen for about 3 or 4 months. So you need to actually be specific as far as the dosage. The doctor needs to be involved. The nurse and the lab technician needs to be involved. And the result of the thyroid situation may require the dosage of the estrogen to be adjusted. So People with normal thyroid function taking thyroid hormone can have a suppressive therapy to prevent the growth of nodules or goiters, are not likely to need a change in thyroxine dosage. So it gets complicated. It really does get complicated here. And I'll grab another sip of water. Patients with specific types of stomach problems. If you've got an existing stomach inflammation, and that's affecting the gastric acid secretion in the body, the absorption of the thyroid hormone again may be adjusted. It may actually need to be raised. So again, you really don't know what is going on until you have the lab checked. H. pylori patients may have to actually have their dosage adjusted also. So you need to know what the circulating T4 levels are, and you just may have to have a dosage reduction. So there's so many different aspects with the body and with the way that drugs are actually metabolized and absorbed in the body. Proton pump inhibitors actually may produce a rise in the level of the TSH. So these are all studies that's been documented in the literature. There's a liquid form of thyroxine that may be better absorbed than the test. So switching levothyroxine from the tablet to the oral solution may correct this particular drug reaction. So proton pump inhibitors such as Prilosec and Prevacid and all of those may have issues as far as your thyroxine levels. Now, if you are breastfeeding and you've had a child, or if you are pregnant, or if the mother is lactating, the baby is not clinically having as many issues there. Nevertheless, it's important to maintain normal levels of thyroid hormone while you're pregnant. So it may be, and in fact it is, a great idea to have your doctor check that TSH level more often while you're carrying the baby. So if you've got known heart disease, particularly if you've got the arrhythmia type thing that's occurring in the body, angina, you should start the levothyroxine completely under the supervision of your doctor, and you do it with the lowest possible dose to start with. Because, again, thyroid has an effect on the cardiovascular system in the body. Again, remember, it's hypothalamus, pituitary, it's the adrenal, and it's the thyroid. And all of those work together to make sure the heart beats properly and you have the right amounts of all the hormones that's affected there, and the neurons and the neurotransmitters. So again, cardiovascular, make sure the doctor is aware of your thyroid levels and are also aware of your testing in those arenas too. All right, now we're going to switch over to T3, and that's triiodothyroxine, T3. That's the active form of thyroid. And T3 is again derived from that conversion. If you're on the levothyroxine, the body's going to convert it with enzymatic help to T3. T3, the triiodothyroxine. And that's going to be done in the blood and in the peripheral tissues of the body. Again, T3 is the more active form of thyroid hormone. And it has a long half-life. Now, T4 has a long half-life of about a week. T3 has a short half-life, meaning that it's made, it's used, and it disappears from our body much more quickly than the levothyroxine. So, why is that important? Because T3 is more potent, and you don't want the body to not be able to convert it into the T3 and leave you hanging here from that standpoint. All right, I just looked at my time, and I've got a commitment that I've got to go to. So here's what I'm going to do. We've gone over the T3 in pretty good effects. We're going to go the T4 in pretty good effects. We're going to go into the T3 in my next presentation, and we'll go over all the different things that you need to know about levothyroxine and the triiodothyroxine, which is the T3. There are many things that you need to know about your thyroid hormone. There are many things that you need to know about how the thyroid works in unison with the adrenals, with your stomach, with the cardiovascular system, with your neurons, with all of the parts of the body. The stomach plays a major role. The cardiovascular system plays a major role. The circulatory system plays a major role, because we're talking about having enough energy to survive in this world. Having enough energy so when you have a catastrophe occur, your body reacts in the proper mode, the proper way. So it's complex. If you can tell what I'm talking about already, it's a very complex world. The more you know about it, the better off you're going to be. This is going to be continued. My name is Tom Jones, Pharmacist. You have been on Tom Jones Pharmacist Live. I thank you so much. God bless, and I'll see you soon.